targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@can.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIB is funded by the National Lottery Community Fund.
Hello, welcome back to the Health Hour. I'm Dr. Tunu Johnson-Shogberton. I'm a GP with a special interest in women's health and the menopause. And I'm delighted to be joined today by two of my colleagues. So I've got Dr. Dornubari Lebari, and she'll be introducing herself in a moment. We've also got Dr. Ayo Olatoye, who's also here with us to be discussing the very important topic of navigating the health system and waiting times. So we know this is an issue that's pertinent, particularly for our Black communities. Many of us are waiting for procedures and struggling to access equitable healthcare within the health system. And so we thought it would be really nice to have a conversation within the panel to try and get some strategies and ideas about how to deal with this challenging issue impacting the health service and therefore our Black community. So I'm delighted to have Dr. Dornubari and Dr. Ayo, and I'm just going to get them to introduce themselves, starting with Dr. Dornubari.
Hi, good morning. Thank you for that introduction. My name is Dornubari. I've met some of you before on CAN, but I'm a GP, but prior to that, I am also a consultant in sexual health. And so, yeah, so I kind of traverse both primary and secondary care to some degree still. Yeah, so hopefully I can give you some insight into both sides of the coin, if you like. That might be helpful.
Excellent. Thank you so much for that introduction. Now, Dr. Ayo Olatoye, please.
Good morning, everybody. Thank you so much, Dr. Tinu. I'm Ayo. I'm a consultant in medicine working in the Northwest. And I've also been a patient, a stroke survivor. So I have, the perspective of being a patient, waiting for services, and a doctor. I'm also, in my spare time, a transformational mindset coach. And I really do believe that body, soul, and spirit have an interaction in how we engage with our own healthcare and our own health, and healthcare in the wider scheme of things. So I'm hoping to bring that to bear in the conversation. Happy to be here.
Love it. Thank you so much. You were speaking my language there. I'm always talking about the bio, the psycho, the social, and how that all impacts, and you bring in mind, body, and spirit. It's again thinking about the holistic. So I'm sure we'll have a lot to talk about with that. Wonderful. So I think obviously for the people who are the audience, we would love for you to send in your questions, because we really want this to be a conversation that is about what you want to hear. We do have some pre-prepared questions, and we will start the conversation. But if there's any questions that are pertinent, please come through, send them through, and we will try to answer them. So we are going to start off the conversation thinking about, so this is for either of you, Dr. Ayo or Dr. Dornubari. So can you provide deeper insights into the typical waiting times that patients experience within the NHS system for different types of medical appointments, and also explain the factors that contribute to variability in the waiting times across the different NHS facilities and regions?
Ladies first.
I thought you'd say that. Yeah, so if you don't mind me stealing, I'm always going to steal from either of you, by the way, just so you know, because I'm traversing both your areas. So, but I will speak about general practice because that's one that I've gone back into from maternity a bit sooner. So I'm very sort of acutely aware of the issues there. The first thing to say about the UK healthcare is that is still disappointing, is that it is very much a postcode lottery. It does really depend, and not even to the point of a postcode lottery, I'd say even to streets or catchment, if you like, because that's how a lot of practices still have to divide their population is based on catchment area. So, and sometimes depending on demand, there's a maximum list size. So you might find, and I'm sure people have found this, you move to an area and there's a GP surgery at the end of your road, but you can't actually register with that GP. You have to register with one that's, a few blocks down, or that you have to drive to, but it's still within the area. So I guess the first thing to say is demand is an issue. Demand has always been an issue when it comes to general practice. You probably have heard lots of people talk about general practice being at the front line and of healthcare, of UK healthcare, and that is true, and that's never stopped being true. But what that means is that when people cannot access any other thing, it means that the fallback is always general practice. However, that, if you like, the standard access of what people require from general practice has never, ever gone down or changed. So the demand will then continue to rise. When there is ever a pressure on any health, on the UK healthcare system, general practice bears the brunt of that. And I've observed that both as a secondary care physician and also as a primary care physician. And I'm not biased, I hope. If I am, call me out. But I was a secondary care physician first and still am. So I've been that the longest. However, and I think a lot of people don't actually fully understand general practice, first of all. So, and there's a lot of, the media have done a really good job of propaganda, but also there's lots of disinterest. Nobody cares to know how general practice runs. The UK healthcare system, where we're at now, there's a certain flavor of sort of demand. I want my rights, I get my rights. And I understand that patients do have a right, but we need to balance that with, well, what are we working with? It's all well and good to demand, but do we actually have the resources to demand XYZ from? So that's the first thing. So demand has definitely gone up ridiculously. And this is not a COVID effect at all. I dispute that it's a COVID effect. The demand has gone up because people have been failed. The system has failed for so long, and now it's on its knees. And therefore, when that happens, it will often, like I said, remember what I said before, general practice will bear the brunt of it. And therefore, the demand in general practice will go up. And that's where we see the demand. It does not mean the demand in secondary care is not there. It just means that essentially general practice is the fall guy. Because when everything else falls apart, general practice is there to pick it up. And so it doesn't mean patients should not demand their rights to healthcare and should not advocate for themselves and speak for themselves. But what it means is that we need to demand more from just general practice. We need to understand that there's a bigger picture to this. There are more people to be held accountable than your GP or your GP surgery to give you appropriate healthcare. I've probably gone off on tangents, so I'm sorry. Just remind me what the question was again.
No, I think you're
No, I
answering
think
that.
you're on. I think you're on.
You're on point. It really was just about thinking about I think you mentioning about the differences between primary and secondary healthcare. I think that's useful. Maybe even just, basic definitions of
I was
primary.
going to say,
Yeah,
can I?
would be
Okay.
yes. So I think we were just talking about the waiting times that people experience and how they
Yeah,
experience them
waiting.
differently.
Yeah.
Right.
Yeah.
So I think what would be helpful, and maybe Dr. Ayo is going to do this, is really explain the basics of primary versus secondary and what the waiting times are, because people are experiencing that pressure in both sectors.
So I wanted to comment, Dr. Donna. I agree with you 100%, but I think absolutely, Dr. Atinu, it would be useful for us to go backwards because some of the terms that we're using, some people don't understand. So I think the first thing that I would say is that we know what healthcare is, and not that I'm biased because I don't want to necessarily feel like I'm defending things, but the thing that people who aren't in the NHS need to understand that the NHS has been propped up by the goodwill of people who work in the NHS from the very beginning. They never paid us enough. So that's one thing to understand. The ethos of the NHS when it first started was to have healthcare that was free at the point of access, because everybody universally has healthcare in any other country you go to. The issue that separates NHS from somewhere else is that you have to pay when you arrive. So in some places you go, they will give you life-saving treatment, but otherwise, that's it, you're on your own. So the unique selling point, if you will, of the NHS is free at the point of access. Now, Dr. Donu alluded to the point that the thing that I think that we're not really talking about in the public sphere is that there is infinite demand and finite resources. So there's always going to be a mismatch. And even though the user, the public, doesn't have to pay in money, the harsh truth is that waiting is the cost of free healthcare. Because the other cost in other systems is money. I pay money, I get what I want. And I'm not advocating for private healthcare. I'm just saying that we have to realize that the world that we're in is the reality is waiting is the cost of free healthcare. Now, that's the preamble. Now, the primary healthcare. So what I want you to imagine is an iceberg. So we all know that people say the tip of the iceberg. So I am a secondary care physician. What that means is that I work in a hospital. I work somewhere outside of a GP practice. Now, I am very clear that the people who access secondary care are the tip of the iceberg, because I see the sickest people, if that makes sense. You have to be sick enough to see me. But the majority of people who are sick are below the iceberg. So my GP colleagues see the most people. Does that make sense? So primary care is everything that you can access on the street, if you will. So your GP practice, your pharmacy, all that kind of stuff that you could just walk in and see, that's primary care. So for the purpose of this discussion, it's probably going to be led by or fronted by the GP who points you in other directions. It might be physio or dietitian or pharmacy, whatever, but let's just say GPs. That's primary care. And if there's an issue that cannot be solved in primary care, then there's a referral to secondary care, and you might see somebody like me. So that's the difference between primary and secondary care. Now, waiting times, because I did some research actually before I came on this, and basically the government has mandated that there is I think it's 18 weeks, that at the point where somebody says, I think you need primary care, the patient has a right to access a consultant or a specialist in secondary care within 18 weeks. Now, the thing that people have to understand is that the NHS isn't as joined up as you think. So what that means is that, so when you go and see Dr. Itinu or Dr. Donu in the GP surgery, and then you come and see me, there are some places where you work where I don't have the records that they have. I don't have the blood test that they have. I don't have your records. And sometimes it's a frustration for patients. So, do you not have my records? The way that records are produced is it's a tender system. So the government historically said, you guys figure out a way of storing records. But because it's not universal, the computer systems that the GP uses sometimes don't even talk to the computer systems that work in hospital. So that's an issue. On top of that, the way that healthcare works is that somebody has to say, I think I can solve this problem for this many people for this amount of money. It's called a tender or a business case. And then they will speak to their local authority, and their local authority will say yes or no, which is why you might go to somewhere in London and they have access to a fantastic service, but you might go somewhere in Luton, which is even minutes away, and they don't have access to the same service because there isn't somebody who's able to provide that service for this amount of money for this amount of people. Now, I'm not defending it. I'm just saying we have to understand this is what it is. So when people talk about postcode lottery and street lottery, unfortunately, as doctors, we would love it if everything was joined up. We would love it if there was one system. We would love it if everybody had access to everything. That's just not the reality of where things are right now. So one of the things that is contributing to waiting time is the fact that maybe I have had people who come to me and I know the problem that they have. And I know that last year there was a clinic that solved this problem, and this year there's no clinic. So I can't help you, if that makes sense. So that's one of the things. I don't know whether Dr. Dorney, you wanted to talk specifically about your area of expertise in terms of sexual health, whatever, but...
I mean, general practice waiting times is variable, but it's still nowhere as long as Dr. Ayo said, sort of secondary care or hospital care. I'm going to put a spanner into your works as well of definition of primary and secondary care, because there is also tertiary care. So I wasn't quite honest when I said I traverse secondary and primary care. That's not completely true. I actually traverse primary, secondary, and tertiary care.
Tertiary.
But that's just to complicate things, because there's another level called tertiary care, which literally you don't even see right at the tip, which is where and tertiary care is arranged in lots of different ways. Some tertiary care you can only access through secondary care after going through primary and secondary. Some of them you can access yourself. For example, our specialized sexual health clinics are tertiary care, so you can only access those if you've gone through primary and secondary. But our general sexual health clinics, where you just walk in, you can access yourself without even going through primary or secondary. Anyway, that's by the by, but just know services are so disjointed. That's basically what we're saying. In terms of waiting times for general practice, most GP surgeries in my area, and I live in Cumbria, a beautiful part of England, have a waiting time at the moment between 2 to 4 weeks to see if you want to see a GP specifically. If you want to see a primary care clinician, because primary care clinician is everybody else who works in general practice. It's not just your GP who works in general practice, as Dr. Ayo says. That could be a nurse practitioner. It could be other allied healthcare professionals. It could be, I don't want to use the controversial term. I'm trying to avoid it. And I don't support or sort of against any clinician. What I'm for is competent clinicians. I don't really care, and I don't label everybody as these shouldn't be in general practice anyway. But just know that there's lots of people in general practice that can help. An interesting thing actually that I was also going to bring up to try and sort of thinking about waiting times is, and a lot of people don't know this, a GP. Whilst the GP is also a specialist, by the way, and I'll come to that hopefully later on, a GP sometimes is not, whilst being a doctor, and people often think, don't they, a hierarchy, like a doctor is above a nurse and above this. In general practice, it's not really like that. And I think in hospital medicine, it's moving a lot like that anyway. We now have nurse consultants who can be more qualified than Dr. XYZ, who's actually, I hate this term, but junior doctor. And so, for example, I know some of my colleagues who, actually, I won't talk about my colleagues, I'm going to talk about myself in general practice. When there was a time when I wasn't as au fait with diabetes as I wanted to be in general practice, and I'll put my hand up, and I know diabetes is, bread and butter of general practice, so how dare I? It doesn't mean I'm not au fait now. However, when I needed to learn more, the people who taught me more about diabetes in general practice were the practice nurses. Why? Because they were the experts in general practice in diabetes. In fact, they often knew a lot more than all the doctors combined. They were up to date because that was their special interest. So, and often with some of these chronic illnesses, patients often think, oh, well, I haven't seen a doctor for 5 years. And my reassurance to you is that's probably a good thing. That means you've probably been seeing the right person, because sometimes when you get a doctor involved, it doesn't necessarily mean they know the ins and outs of diabetes. In fact, you have probably been seeing the diabetes specialist nurse who has been more interested and more managing more diabetes than a lot of your GPs, than a lot of the GPs at your surgery. And so actually in that scenario, I would encourage you and say, you don't need to see a GP. You need to see the diabetes nurse or the practice nurse. And you'll find that practice nurses still today, because I did check this last week with one of the practices I work with locally, till today, the practice nurses lists are still easily accessible. Why? Because people don't routinely book on those, or they don't routinely request those. When anybody calls a surgery, they go, I need an appointment. And especially now, I often hear, I need to see a GP. That's fine. But I'm just letting you know that whilst your GP is competent and a specialist doctor, depending on what you're calling for or what you need to see somebody for, they may not be the best person to see. Newsflash. So that's the first thing. Interestingly, somebody's just put in the chat, and I was going to touch on this. This leads me on to why the receptionists are so nosy in general practice. That's why they're nosy, and they want to know what you need an appointment for. It's not because they're going to call Hello Magazine and tell everybody your ins and outs. It's not because they have a power play or they want to deny you an appointment. I guarantee you, it doesn't matter how horrible that receptionist is. It is not for those reasons. The reason is they want to get you the right appointment with the right person as quickly as possible, because that is what they've been entrusted with as their job. So when they are asking you what would you like the appointment for, whilst you are well within your rights to demand to see a GP, bear in mind you could be waiting 4 weeks, or in some places even longer, to then see the GP. And I've seen this happen quite a few times as well, only for the GP to refer you to the practice nurse who you could have seen 4 weeks earlier. So in terms of navigating the healthcare that is complex, that is clearly working against us all, this is one of the things to be aware of. The receptionist is not your enemy. The GP receptionist is not your enemy. And in fact, I would just like to remind people that, you catch more, what was it my mum used to say? Catch more bees with honey, even though it doesn't make any sense, than vinegar. Yeah. So even though it doesn't make any sense because bees make honey, but anyway, you get my drift.
Thank you.
Nice. Yeah, go on.
Yes, sorry, finish what you were saying.
Be nice to them, explain to them what your needs are, and also this also helps in terms of timing. So people often go, oh, well, I haven't seen a GP, I haven't been able to get a GP appointment for this long, but then said I could only talk about one thing. Okay, when you call the receptionist, let them know, listen, I've actually got 3 issues I want to deal with, and try and prioritize them. Again, it may be that you need one appointment with one person to deal with all 3, but it may be that you need a GP appointment, a practice nurse appointment, a physio appointment, a podiatrist, something. But the receptionist is there to actually help you navigate the complex map of general practice clinicians. They are not your enemy. I guarantee you, they are not your enemy.
Thank you for that. And I think it's really important to understand that, especially now we have so many different people working in primary healthcare. It's important to know that each person has their own special interests. And oftentimes you've even got pharmacists who are working who might have a special interest in things like diabetes or high blood pressure. And I think when people work within the scope of their competence, we have really great multidisciplinary teams, and it's really that's where the receptionist can help navigate. But I do appreciate that sometimes it's not communicated very well, and therefore it can feel like they're gatekeeping in a way that feels unhelpful. So again, it's about communication. So there is work to do on our part to ensure that we are communicating appropriately with patients. And that's why we're doing this kind of education now. So I think it's really important to let you guys know that this is meant to be interactive. We're not just trying to talk at you. We want to hear from you. So please raise your hand or unmute or put your questions in the chat box, and we want to hear from you. Now, I've seen a few comments, which I thought is really important to pick up on that. So someone called L Walker, I'm just going to come to you in a minute. I just wanted to raise, somebody has put here, I disagree that the NHS is free. My tax is utilized towards keeping it running. So it's not free at all. I paid upfront for it. And I completely, because it is not free. It's free at the point of use, but it's not free. It is paid for by our tax money that is collected by the government. And that's the challenge, is that, you know, we have, as Dr. Ayo was saying, finite resources and infinite demand. And the demand keeps growing as we have a growing population. And that population is growing for multiple reasons. Somebody has mentioned about, you know, is the government biting off more than they can chew by welcoming immigrants, but not expanding the healthcare system. So it's not just immigration by which the population is growing, but also our current population is getting older. And so as people get older, they have more healthcare needs. Now, you know, immigration also brings a lot of benefits to our communities. So again, when you're thinking about immigration, it's not just a straightforward, oh, we have more immigrants, and so the healthcare system is overwhelmed. It's not quite as straightforward as that, because with a lot of the time, immigrants are paying a surcharge to use the NHS. So it's not like they're just using it for free. And then secondly, immigrants are adding, a lot of immigrants are working in the healthcare system, for example. So I don't think we can fully blame the problems on just immigration. It's a very complex topic and it's outside of kind of like the scope of this conversation. But I just wanted to kind of make it clear that it's not so simple. So yes, your tax is used to maintain the NHS. But again, that still means, though, that there is a mismatch between resource and utilization. Now I'm just going to go to Elle Walker for you to ask your question. You're muted.
Hi, can you hear me now?
I can hear you, yes.
Hi, good morning. Thank you for this talk. And I really appreciate your comment that, you know, this is for us to have a conversation and, you know, not to be talked at, because I do agree in terms of the fact that the receptionist, I was the one that made the comment about gatekeeping with the receptionist. I do agree that obviously that they do need to know at least the top line about why you're ringing. But unfortunately, there's different levels to receptionists, and I think it is important to have this conversation, because obviously the GPs, the nurses, you will not be aware because you're not on the conversations with the patient. So with me personally, I've had examples where, depending on which receptionist I speak to, one will refer me to triage if there's no emergency appointments available, and then I'll speak to their colleague and they'll say, oh, we don't do that. And then I'll challenge that and say, actually, you do. Oh, let me come back to you. Oh, okay, then we'll you know, so it's about training. I've had experiences where my medical records have actually been lost between transferring from GP to GP. Once I speak to a GP or a nurse, they're very helpful, but sometimes it's actually getting to see them. That is a challenge. And I'm really happy about the information you've shared around the fact that there are specialists. I've been able to tap into some of the community nurses, for example, but the receptionists have not been the ones to give me that information at all. It has been the GPs, or it has been A&E that have asked me, have you not been referred to this? Have you not have access to this resource? And then they have been the ones to make the referral, not the receptionist. And when I do read reviews about the doctor surgeries, especially when I've been looking for new ones, the complaint and the frustration is rarely the doctors or the nurses. It is the receptionist. And I do believe that this does need to be addressed.
If I can jump in, and obviously you've had a challenging time, and I think I can recognize that it can be frustrating when you need to access something and it feels like somebody's intentionally sometimes putting a barrier in front of you. So for that experience, you know, I do apologize. I think we have to also put this in perspective of like the wider life, because I don't think it's necessarily just receptionists in NHS who feel like gatekeepers. Have you ever been to a library where the librarians talk to you like they're king? You know, shush. So I get it. I think I think the difficulty is that the access to healthcare and stuff is probably what we are wishing is different to what we're experiencing just because of the fact that the demand. So, and a lot of I'll be honest with you, my opinion is a lot of the systems and the practices and the education probably hasn't caught up with where the public feels they need care right now. I do think there's a conversation to be had in the public space because my opinion is that given there's this massive mismatch, we just have to be honest and to say, I'm really sorry, but the thing that you're asking us to do, we can't do. An organization as big as the NHS, it's difficult for it to be responsive and agile and patient-centered and quick as you would like it to be. And it's not for lack of want. It's just it's difficult to do that given how big it is. Specifically about the receptionist. I mean, I'll be honest with you. I think that it's back to the point I made before about the NHS not necessarily being as joined up as you think, because I recognize completely that situation where somebody's come and seen me and I've said something and they're like, oh, I've never heard that before. And conversely, they've asked me something that I don't know and a colleague right beside me knows information that I don't have because we're all experts in our thing, but you only have the experience that you have. And I think that you highlight a point that I'm going to take back, to my area and just make sure that everybody that I'm working with is as knowledgeable as they can be about everything. But I think we have to help each other and maybe have some grace for the humanity of the other person on the other side of the desk that they may not know everything. You know what I mean? Because that's just unfortunately how things are right now.
So I think it's really important because, again, for a lot of people listening, you're going to be thinking, okay, so the system has all these issues, but I have my own problems. So how do I deal with that? And I think, you've got to have almost like two perspectives. And one is, as Dr. Ayo was saying, understanding and extending grace. But I also think that there's the aspect of advocating for yourself. Now, Dr. Ayo has mentioned about the fact that he has been a patient. Now, I have been a patient as well. And not only that, I'm a mother. So I've had to try and get appointments for my child if they're unwell. Now, I've had the luxury of being a GP and in difficult situations because I've literally called my practice at like 2 p.m. The practice doesn't close till 6. And my son has just become unwell and they've said, oh, there are no appointments left. You have to call 111. I've called 111 and I've been on the phone waiting for an hour, waiting for an appointment. And this is on a weekday in the afternoon. And I'm thinking to myself, this child has a fever of 40. So I've been that parent as well. I mean, I have the privilege of being like, okay, do you know what? I'm just going to call work and see if one of my colleagues will see my child, which I have done. But that is my privilege because I'm a clinician. And actually, a lot of people will not have that privilege, right? So how does someone in that situation and they have their child with a fever of 40 and they're really worried and they're on the phone to 111 and they can't get an appointment, is how do you navigate that system? I think we're hearing you as well, because it might feel a little bit obstructive, like it's 2 o'clock. How are there not any appointments for a child under 5? Like, these kind of children should be prioritized, and it can feel a little bit like, is someone being obstructive here? But as Dr. Ayo was saying, we understand the system is overwhelmed. There's probably about 20 moms calling saying, I've got a child with a fever. And so they have to then navigate, and then you have to figure out, how do I get the care? Right? So there are walk-in centers, for example. Sometimes you just have to wait, as Dr. Ayo was saying, and like take them to a different place where you can get help. And it's frustrating, but it's the repercussions of that mismatch in demand. But again, that doesn't mean that you shouldn't get the care that you need. So it might be a little bit of agile thinking and advocacy for yourself. And sometimes you might need to make, like, say, for example, if you can say, like, like El Walker mentioned, somebody has done this for me before. Can you look into it? So sometimes you might need to advocate for yourself. So I'm just going to go to iPhone Xmas. I think you raised your hand, and then we'll go to Zoom user. So iPhone Xmas. Oh, are you there?
Sorry, Doctor. I had to send the message to them to rename themselves. So I think they're trying to do that. Otherwise, I'll put them in the waiting room. Yeah.
Hi. Yes. Please ask your question. Oh, we can't hear you at all. We can't hear you. Maybe type your question in.
I think they have. I think they have. So in the chat, they said, I also had feedback on bloods from a receptionist that was incorrect. Further delayed my brain tumor diagnosis. I don't think it's intentional, but I think training is required. I agree with the earlier statement. It's a difficult situation to navigate as a universal system, but in some cases, life-threatening. Really would love to understand how I can tap into other options or navigate issues. So it seems like iPhone Xmas has had a diagnosis of, oh, here we go. The original.
Earlier on. It was earlier on.
I have a benign brain tumor, struggling from beginning to now to navigate waiting times and understanding my health status. Any advice? I've even raised a complaint through PALS. I also have a private healthcare backup, but it's costly. The management of it for me is super stressful, which does not help my condition. Thank you for this forum.
Can I add? So I've been making notes. So there's a few things that I wanted to just add to what's already been said with regards to navigating stuff in the receptionist, etc. So, El Walker, obviously, I hope you don't find any of our responses patronizing, because it's not meant to be. Not as has already been said. Even if this was, well, there's no such thing, but even if this was a very good, near perfect system, it would still need for us to have this conversation about how to navigate it. But we are in very muddy waters. We are probably the muckiest waters we've ever been in with this system. And whilst I don't necessarily agree that we can't hold the NHS as an organisation to account, we can. And I think one of the ways we've been telling ourselves that is we talk about NHS as a whole entity. It's not a whole entity, as we've already mentioned. That's the first thing. Any system is literally just a collection of people. And you are completely right, there needs to be training. But, and as has already been said, there needs to be some understanding that any system that is made up of people, because that's who makes systems, will always be imperfect and will always be room for improvement. It's interesting what you said about the online reviews, because that's one of the things that I often look at for any practice that I'm considering working with, even as a locum or as like sometimes I do training with practices. And so that's one of the things I'll look at. I'll look at what is it about this practice that the patients are unhappy about. The other thing I find interesting about reviews, and I would like to challenge all of you, because this is something I try and actively do, it takes more effort to write a good review than a bad review. Full stop. You can challenge me on that all you want, but I've got all the evidence. It takes more effort to write a good review. And when you've had a pleasant experience, you don't go home and go, do you know what? I'm going to go on NHS.uk and I'm going to review this practice or this clinician I've seen, whoever it is, or this hospital. But when you've had a horrible experience, most of us are very good responding to our keyboard warrior inner selves, which is fine and I think is warranted because there is use to that. Hear me out. However, I would like to challenge you to also consider, when you do have a positive experience or a not so bad experience, and think, what made it not so bad? And if somebody forced me to write a review every single time I have a not so bad experience, what would I say? And I would challenge you to maybe even write that, even for yourself, so that you know what it is, because what it is to help improve the people in the system. Because I'm not going to say the system, because that sounds like a far-reaching, almost unattainable goal. Oh, improve the system. It's not. You just need to improve the people in front of you, starting with yourself. And I'm talking about myself first. Hearing you tell me about those frustrations that you had trying to navigate care for yourself annoyed me, upset me. and also brought me back to when I've been trying to navigate the healthcare system for my mom. And bearing in mind, I'm a doctor, I'm dual qualified. I've been working in healthcare for a while in this country. The GPs at home, where I grew up in Liverpool, know me even before I went to med school. They did my bloods before I went to med school. One of them even wrote one of my references. That doesn't count for anything. I can tell you that for free. And I've still had difficulties, and it is frustrating. And I'm not trying to be patronizing. A lot like where a lot of us would have experienced being racism, and whose job is it to fix the racism in this country? It is not the perpetrators, it is the victims. This is a lot like that. And so consider it in the same way. I know it feels overwhelming. Trust me, I've never been a fighter. However, there was a really good speech that I came across where David Morrison said, the standard you walk past is the standard you accept. And when I was I think probably soon, fresh out of med school many moons ago, one of my supervisors told me something that I still never forget, and this is literally how I conduct myself, is you need to look at your patients as people. Mm-hmm. You need to look at how you care for them. You need to review that even within consultations where you're getting frustrated and where you're getting you kind of feel like there's a lot of argy-bargy, you feel like you didn't really get anywhere, you feel like the patients are still upset with you and didn't get what they wanted from it, despite you spending an hour with them. It's a good one to examine and think, why is that? Or what did you do? What was your role in that? Number one. And number two, are you happy with the care you're providing? Would you be happy if that was your mother, your brother, your sister, your father, your grandmother? Would you be happy with that care? And for me as a clinician, if the answer is no, then I've done wrong. If the answer is no, I wouldn't be happy, then I've done wrong. And I need to call that person and I need to apologize and I need to fix it. But that's me. I am one person. I am not perfect. I know that. And that's how I examine myself. A lot of my colleagues may not be aware of their unknown unknowns, the unknown deficiencies they have. Your receptionist, your whole surgery, like you said, may not even be aware, the doctors, the nurses. And remember, not every doctor is literally the kingpin of your surgery and maybe doesn't have as much power as you think they do. Not every doctor you see in your surgery runs the surgery, is what I'm trying to say to you. So it's not like, oh, I need to get to the doctor to report. No, find the right ways. And you're right, I do advocate always going through PALS, raising complaints when there are inadequate care, because that is the only way we get to know. If we don't know, we can't fix it. If you walk past that standard and say, oh, I can't be bothered, it's too much work, you've accepted that standard, not only for yourself, but for the next person who comes after you. Go to the next PALS. If PALS is a major situation where I know it's frustrating. I know it's an uphill battle, and that's why we're having this panel discussion. How are we going to start to navigate this? The other thing I want you to be aware of, because I see this even in our area where we've got an upsurge in the number of melanated individuals, should I say, because I'm in Cumbria, in the northwest part of Cumbria, where there was no melanin even when I arrived, is we are not represented. There is something called a patient participation group. They have a lot of power. Patient participation groups exist in healthcare. Particularly, they have a lot of power in GP surgeries. In fact, GP surgeries often cannot institute new services or without feedback from the patient participation group. Make yourself one of them. Engage in your patient participation group. Be the voice of feedback, because if your voice isn't heard, you're not being represented. Your views are not being represented. Okay, and everybody thinks things are tickety-boo, like, oh, we've run it through patient participation group. It only takes one. I know in quite a few practices actually around here, patient participation group is everything. If one member of the patient participation group objects to something, it needs a re-examining. So you have a lot more power than you think. You just need to know how to utilize that power. So get in contact with your GP surgery, for example, ask for your patient participation group contact details, engage with them. It's not a big committee that requires lots of meetings, etc. Literally, you can just be on the list that when they need feedback, or when you want to, when they're going to change anything, or they're thinking of doing anything, or you want to just feedback to say, actually, your receptionist need training. bear in mind, a lot of training sometimes is done in healthcare, and I've noticed this, especially in GP surgeries. I don't know why, but a lot of training that's done is hearsay. It's done by hearsay. The person above trains the person who's new, tells them the same thing that they've been telling for 50 years, even though things have moved on. So yes, you are the one who's going to be responsible to tell them the truth. Don't be shy about it. You don't need to be rude about it. Just, again, like you did, you challenged them, and then they had to go and look it up and be like, actually, oh crap, you're right. Okay, fine. Yeah, put my hand up. And think of how many other people you've helped by doing that.
No, that's really helpful. Thank you so much, Dr. Dornu. I'm going to go now to Zoom user because you've been raising your hand for a while. So yeah, you can please ask your question.
Thank you very much. And it's been very interesting hearing you. But I would like to go back to receptionists for what Dr. Ayo said. You know, we know sometimes you go to the retail places, anywhere else, and the staff, you know, just ignore you. But this is health. This is where you are concerned. And it is really unacceptable when you're so nervous that it doesn't make it the right for us to accept that receptionists are off-putting. But at the same time, we have to remember that receptionists are at the receiving a lot of negative things, and they're only human beings, you know? So we too should use the honey. But going back to what one of the other, somebody else asked, they said they had done some kind of research, and the complaint is always about receptionists. And I think that shows there needs not just one person training somebody who comes in, there needs to be thorough training for receptionists. That is our start of being able to navigate the health system. Thank you.
Thank you very much.
If I can come back on that, I think fantastic. I think it's very well articulated, and I agree with your points. I think so one of the things that I do is I train junior doctors, and one of the things that I say to them, because even in the health service, there are things that we're unhappy about. And I say to them, there's a difference between complaining and escalating. Because complaining doesn't solve problems, but escalating helps solve problems. So just like Dr. Dornu said, I think everybody who has had a negative experience with a receptionist, whether it's at a GP surgery or a hospital, you have the experience. And if it's happened to you, potentially it's happened to other people. I think that as the representatives of the healthcare service, I would like to say, I'm sorry that happened to you. However, I would also like to say, as a human being, we have responsibility to our brothers and sisters and say, well, the person on the other side might not have known how they come across. So let's find the appropriate way of saying, this is my experience. Can we talk about making sure this doesn't happen to anybody else? Just like Dr. Dornu said, find your patient participation group at your GP, speak to pals in the hospital, because I think the principle is more important than the emotion, if that makes sense. If it shouldn't happen, the issue isn't that it happened to me, it's that it happened at all. So let's find a way of saying, in the appropriate channels, can we look at this? Because I think somebody may need to address this from an official point of view. I think we've got quite a lot of questions in the
We do. Someone has mentioned about social prescribers, and I really want to highlight that because they're a very useful source in the practice, because they often have local knowledge of their many local charities and community resources that are available that can support. Say, for example, if you've got a child with special learning needs like autism or ADHD, there might be community resources that can support you and your family. Now, they're national programs, but a lot of the time, the waiting lists for those things are incredibly long. But you may have a local service, and the social prescriber may be aware of how you can get referred to those services. But also things like, you know, exercise on prescription. So say, for example, if you can't afford a gym membership, you may be able to get those kind of referrals on prescription. So so you know, there's so many things like mental health support. So like, you know, some people go for like gardening, and they use that to help their mental health. There's so many different things that the social prescriber can signpost and refer you to. So again, knowing about the social prescriber, and often, because a lot of them don't have patient-facing time, so they're usually easily accessible. So they might be somewhere that you can use to get self-help. So I know that iPhone Xmas, you have your hand raised. I will just let you ask your question. Oh, has she disappeared?
Yeah, I think that was her. That was her previously. Just
oh,
asking.
it's an old hand.
She's
Okay.
put something in the chat though. Basically, I think I'm wary of going in depth in a very specific case because I think there's lots of things that you know that we don't know, and it might sway the advice that is given. So I know that I think your name is Janine. I'm happy to make myself available if you want to contact Khan to have a specific conversation about your case. I think that's probably more useful.
Yeah.
Talking about it in this
Yes.
forum.
So thank you for that. So someone has asked a question about whether the NHS needs to make another decision about whether we charge up front. I think that's quite a useful question. So this is from Hazel. So thank you, doctors, for the explanation about GP receptionist. She doesn't like to explain because she feels that the receptionists are not truthful. And also, if she knows someone in the practice and she's not very happy sharing her private information. And so she's had experience of paying for healthcare. And she's just wondering, in fact, I was having a conversation just a few days ago about whether even a nominal charge where you can claim it back. So you actually have an awareness, you get a bill and you have an awareness of the cost, whether that could be helpful. So I'll just hand it over to the panel for your views on this.
I used to joke about this when I first qualified that, when you go to A&E, you pay £5, and if you're really sick, then you get your money back. Because there's a lot of use of the service. And I think, jokes aside, I don't want to belittle anybody's experience of A&E. I think that there are times, and there is a proportion of people who may be accessing the health service, but at not the most appropriate door, if that makes sense. And what that does is, again, because there's finite resources and infinite need, I can't get past the fact that me seeing a patient means that I can't see another patient because I'm seeing that patient. And if that patient that I'm seeing in front of me probably could have accessed another service, it's not a waste of time. It just means that somebody else couldn't have used that time because it's finite. Specifically, about the point that's being made. So I am very much an advocate for people taking responsibility for their care. What I want to make sure is that we are encouraging, especially in the Black community, because what we know is that we're not necessarily great at health-seeking behaviors. So our white and Asian colleagues will do other things, even if it's to do with taking responsibility for personal health care in terms of exercise, sleep, healthy eating and stuff. So that's the place to start, because if I can do that for myself, my need to access healthcare in another setting, it goes down. That's number one. Number two is that I also need to educate myself, because actually, maybe before this conversation, you didn't know the difference between primary and secondary healthcare, or you didn't know that waiting for a GP might not be the most appropriate thing because there are specialists in the GP surgery who could help you, and you could have seen somebody 2 or 3 weeks earlier. And I have to deal with the emotions of, I grew up always seeing a GP, but things have changed now. So maybe the way that I've grown up thinking I will always access healthcare has changed. So I need to change. Also, I will always advocate for people to move towards what I call an internal locus of control. What I mean is that this isn't disrespectful to anybody on the call. I think in society, there are lots of conversations where people are complaining about things that they can't change. From a mental health point of view, that's not healthy for you. I think in everybody's situation, the most important thing is that in the things that are, this is my life. What can I do to make sure that my life is as fantastic as it can be? So I would encourage everybody to take the time to investigate, well, actually, what would private healthcare cost? What would it look like? That's number one. Secondly, I would encourage people to say, in my local area, if I need X, Y, or Z, what's the best way of accessing it? Because a lot of us have spent lots of time figuring out who's playing who's going out with who, all these kinds of stuff online, and we're not necessarily spending the effort in educating ourselves about our life. This is my life. This is my body. And as much as a doctor, I want to do the best I can to make sure that you have a good life. It is actually your life. So all I'm giving you is my advice. So I would encourage everybody to take the time to say, I want to live as long as well as I can. Let me educate myself with that. Now that might be actually, do you know what? £10 a month. Because if the thing that is worrying you is waiting, the current system that we have, the only way to solve that problem is to find another way of accessing care that's not NHS, because we can't do anything about it today. Whilst there are conversations happening in the background, we as doctors are petitioning the government to say, we need to change how patients access healthcare, but we also need to change the image and be honest about what we provide. Maybe the thing that the public is asking us for, the reality is that I can't provide it like that. And I'm really sorry. I wish I could, but I can't, as a hospital doctor, give you access to an MRI in this health economy today, tomorrow. I hope I'm making sense.
Yeah, definitely.
Yeah.
Go on.
No, please go.
No, you probably heard me. I was literally bouncing off my chair when you were saying about, us having, taking responsibility for our own selves. Because I think that's also where we need to not be giving away that responsibility, because whoever we're giving it to will never be as good an advocate, because they don't know us as much as we know ourselves. And I'm not saying to take that to your healthcare provider and batter them over the head with, I know my body, which is fair enough. Good, do, but let's have a conversation and know that you are the master of your own life.
Absolutely.
Okay, so therefore, don't be sitting and going, oh, well, the system did this to me. No, it didn't. Only the things that happen to you happen with your permission.
Yeah.
Plain and simple. So, just you can take control. The other thing I just want to mention, I know I try not to do politics, too many insects, but you will notice that every general election, in fact, every election, the NHS seems to be this football that goes between all the parties. My question that has still never been answered since I was 14 years old, and I'm in my mid-40s now, so do the maths. My question that I always had, even as a teenager, I remember I said this to my dad, and he literally looks at me like, what? When there was another political party on the telly talking about the NHS, and we're going to do this to the NHS, we're going to put this funding. My question is, how? Don't tell me what you're going to do. How are you going to do it? Because everybody's very brave. And when you ask your MPs this, you watch their face be flabbergasted and watch how they do not even begin to understand. Even what we've just discussed today about understanding primary and secondary care, most politicians and most people in power who are making decisions about the system and the healthcare system that is already on its knees do not understand a damn bit of it. If you ask them, how are you going to do that? So don't tell me you're going to push loads of money into the NHS. How are you going to do that? Where are you going to get the money? How's that money going to be used? How? Tell me the how. You're going to get more people to see their GPs within 2 weeks. How? Exactly how? Tell me the steps that I need to take. So again, I ask you, go and talk to your local councillor, an MP who's an MP vying for your vote. When they talk all these pretty little things that sound like lovely little fantasies that will never materialize into reality, ask them the how.
Thank you so much. That's really important, because, the challenge here is that, what the NHS was designed for, society has so drastically changed or drifted that it's very difficult. And I think we have to have and obviously that's way outside of the scope of this conversation. We have to have long and honest conversations regarding what can the NHS provide. But I just want to bring it back to the individual. And I love what Dr. Ayo is saying about you taking control and ownership for your own healthcare, because it's really important. As a community, you know, we have some of the worst health outcomes in almost every specialty. And are we focusing on prevention, the lifestyle stuff? Are we learning? And that's why things like the health hour are really important, because you then have more information. You can seek you know, you can ask the right questions, you can seek the right answers. But I understand that when you are the person, you know, in that situation where you're wanting healthcare, it can be very difficult thinking, how can I navigate? Of course, there might be an option of going private if you can afford it, but for a lot of people, it's not affordable. And you're thinking, how can I do that? And that's why I think, you know, understanding the healthcare system, understanding the difference between primary, secondary, tertiary, understanding how you can access that healthcare, understanding, you know, that there are different individuals within that service that you can more easily access, but also knowing how to advocate for yourself. So like as a clinician, you know, the waiting list to get advice, like some is 9 to 12 months. I mean, I have a special interest in gynecology. So when we're seeing patients, so we're community gynae, in a community gynae clinic, some of these patients were referred 9 to 12 months ago. And it's very difficult. Now, as a GP in practice, you know, I've actually had to upskill in so many different specialties. Obviously, I've got my sexual health and women's health expertise that I've done extra training in. But, you know, even like in dermatology, I've had to seriously upskill. Now, a lot of GPs would be doing that. But again, there are ways in which GPs can get on the phone. So there's stuff like Consultant Connect, where a GP can get on the phone to a specialist for immediate advice. Now, like I do this a lot to try and move things forward for my patients. If I know it's going to be like a 9-month waiting list and I'm thinking, do you know what, is there something that I can do now? I might pick up the phone. Now, I know that this is difficult and you may not be able to get your GP to do that, but you know, there are resources available to be able to get, you know, if you advocate for yourself, and mention some of these things, perhaps it might get them to jog their memory and think, oh, actually, that, you know, they may be able to. But again, you know, everyone is different. And like, I'm not saying that all clinicians will have the time or the resource to be able to get you specialist advice, you know, as quickly. But what I'm saying is that the more you advocate for yourself and you explain your situation, and the more you, without being, you know, the more you're understanding and explain that, you know, I know this is very difficult, but I am suffering and stuff, then people can see what they can do for you, even within that. But sometimes it's just not possible. And I think understanding that as well. So should we be thinking when we're young and private healthcare is a lot cheaper, should we be thinking about, do you know what, if I can afford it, is this something that I should be thinking about getting some insurance? Again, this is obviously a bigger conversation, and I know that people, a lot of people, that's a challenging thing, income, especially in our communities. So I'm not trying to put any pressure on anyone, but I'm just saying that we have to be thinking outside the box about how we can get equitable healthcare. So it's coming up to 12:05. I'm just gonna give Dr. Dornu and Dr. Ayo just a moment to kind of give their last thoughts, and then we'll hand over to Sam.
Is it ladies first again?
Ladies first again.
So I'll be really quick, sorry, because I do realize in my efforts to not talk too much. So my final thing, you're the boss. You are the boss of your healthcare. And even if there's somebody standing with you at the end of the day, the buck stops with you as well. You have to fight for yourself and the people around you if you can, the people around you, but you first. And in doing so, think about maybe prevention as well, as we've all said, maybe try and prevent you needing health care. My final comments about that, a very good friend of mine was talking about life insurance and basically had a quote, and she doesn't have any medical health problems. In fact, she's 2 years younger than I am, doesn't have any medical problems. What she does have is she's carrying a bit more weight, and she, a long time ago, got diagnosed with polycystic ovarian syndrome, which is like a metabolic thing. Anyway, she's got no health conditions. Anyway, she was quoted a ridiculous, that first of all, nobody would insure her life insurance, and she's got 10 kids. Yay, which is why she was thinking about it. Nobody would insure her, and the only underwriter that then they finally found that would insure her requested £200 a month. £200 a month to insure her. She does not have any health conditions. She inspired me to get my ass moving, and I'm back on my treadmill because I'm already older than her and I already have some conditions. I was like, well, I'm not looking at life insurance. So just bear that in mind. The cost you might pay to protect the poor quality of life you have is a lot more than what you might pay just to prevent you getting there in the first place.
Prevention is better than cure. Wonderful. Thank you very much for that, Dr. Donu. I'll be very quick. 3 points. First thing is prevention is better than cure. I agree with that 100%. Second thing is, again, I would advocate all the time, an internal locus of control. So I would Google the Serenity Prayer. And for those of us who like Netflix, my challenge to you is spend a week not watching Netflix and actually educating yourself on the NHS. There's loads of stuff on YouTube. There's loads of stuff online, because you'll be better for it at the end of it. My last thing is that in terms of perspective, I think it's really important. So those of us who know the story of Adam and Eve, this is the way that I heard a perspective of it that really changed my view. God said to Adam and Eve, you have everything. The only thing you don't have is this one tree. And the person that was preaching, he was saying that Adam and Eve's issue was they had to walk past everything they had so they could concentrate on the one thing that they didn't have. Perspective, I think, is really, really important. And I think it's important for us to the NHS is what it is. It is right now. I would challenge you to get sick anywhere else in the world and call me because I think that your experience might be different. But I also think that in your hand, in your life, in your village, there are things you can do right now that will help you in the future in terms of making sure that you can live well for long.
Thank you so much. And thank you for everyone who's contributed. I know people are still asking questions and, bringing things to the table. So thank you so much for all your thoughts, all your contributions, all your questions. I hope you found this informative. And we're trying out this new style. So hopefully we'll have more of these panel discussions as part of the Health Hour, something a lot more interactive going forward. So I'm just going to hand over to Sam.
Hello, everyone. Thank you very much, doctors, for your very informative session on navigating NHS. You mentioned there are complex ways that information could be broken down from lack of connection between each NHS body. But we appreciate the efforts in breaking that down and giving us the right information. I'm just going to go through the closing slides. Thank everyone as well for listening and contributing with your points in the chat and asking questions, and those of you that put your hand up, thank you very much as well for making it an interactive session. So next week we have Health Hour again, same time, same place. Please feel free to tune in, share this information with your friends and family. We'll be posting on social media the topic in the coming days, so please look out for that. And if you do enjoy these sessions and you want to know more, you want to find ways to contribute and be more part of it, please do email info@khan.org.uk with your topic options and ideas. Would deeply appreciate that. On Tuesdays, we have Healthy Hearts. Again, the topic has just been released. It's Holistic Healthcare Part 2, which is a topic that we covered earlier on this week. So feel free to log in next week, Tuesday, on the 18th from 6 p.m. And Dr. Hiba will be going through holistic healthcare part 2 with you and the community. We do have family advocate session happening on Wednesday. Again, if you are interested in this, please email advocacy@car.org.uk for the upcoming session, which happens every second Wednesday of the month from 6 to 7 o'clock. On the 22nd of June, we have Windrush happening at Alexandra Park in Manchester. If you're in Leeds, Liverpool, and the surrounding areas, Bolton, Salford, and you want to come down to Manchester, Alexandra Park is the place to be on Saturday. There's going to be food, fun. We're going to be celebrating the Caribbean culture. And this year's theme is Archives of the Windrush. So if you were there last year or the year before, you knew it was a fantastic day. This year, we're hoping the weather holds up, and I'm sure it will be. And it'll be a great celebration to see everyone in the community turning up, having a good fun, smiling, dancing, and celebrating Caribbean culture and the hard work of the Windrush generation. So we look forward to see you there. If you have any other questions about Windrush, please email windrush@car.org.uk or go onto this link and register your place. We do have stalls available, so please feel free to get in contact with us and we can see if you are available to get a stall at our event. We do have the Black Healthcare Award coming up in July, on the 27th of July at Park Plaza. Please feel free to scan the QR code. Nominations do end tomorrow. If you want to nominate a healthcare professional, please do that in the next 24 hours, as nominations do close tomorrow. Feel free to purchase a ticket. We'll be celebrating Black healthcare professionals. This has never been done in the UK, and this is the first time it's going to be done. So please feel free to book your tickets and come celebrate with us down in London. Wanted to thank you again for everyone that's listened to today's session. We hope that you've been able to understand how to navigate the NHS a bit more, be able to understand how the receptionist process works and how to get your information through to them and how the GPs deal with various issues. So if you have any other questions or any additional points you'd like to be involved with the Health Hour, please do email info@car.org.uk. Thank you very much for a wonderful day, guys, and have a wonderful evening.
Welcome to our Caribbean and African Targeted Health Improvement Programme, CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our Health Hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.